Now, 80% of the people, almost 80% of the people all around the world, they are right-handed. Okay, right-handed. So, which implies that left side of the hemisphere or left cerebral hemisphere, it has got more representation or like the categorization. Previously we used to call the dominant and non-dominant hemisphere, right? Dominant and non-dominant hemisphere. Now this term is almost obsolete nowadays, because the dominant and non-dominant itself suggests, like, dominant means one side of the hemisphere does all the work and non-dominant is kind of a useless. No, that's not the thing. The dominant one, like say when we say the 80% of the people are right-handed, it means the left side is dominant. What does it mean? It means the left side of the hemisphere is concerned with the categorization of the movement. The neurons in the left cerebral hemisphere are more developed for the categorization for any motor movement, skilled motor movement, to perform any voluntary movement. So this hemisphere, instead of the dominant, it is called as categorical hemisphere. So in the right-handed people, the left cerebral hemisphere is categorical hemisphere, and the remaining 20% of the left-handed. Out of the left-handed, mostly the left-sided one is the dominant. The one very few percentage of the left-handed person, they are called as strongly left-handed. Means they perform each and every task with the left hand. The strongly left-handed, in them, like 2 to 3% of the left, like out of 20% of the left-handed, 2 to 3% which are strongly left-handed, they will have the right cerebral hemisphere as the dominant or the categorical one. Otherwise they will also have the left cerebral hemisphere as dominant or categorical one. The non-dominant one, previously called non-dominant one, actually this is concerned more about the spatial orientation, the visuo-spatial orientation. So this one is also known as, nowadays, instead of the non-dominant, we use the term representational hemisphere. So we can say the categorical, almost more than 80%, almost 80% are right-handed, and out of the 20% left-handed, we can say 15%. So up to 95% of the people, they have left cerebral hemisphere as categorical one, and the remaining 3 to 5% of the people, they have the right as the categorical one. Okay, and the non-dominant is the representational. Means if you are right-handed, you will have left cerebral hemisphere as categorical one and right cerebral hemisphere as representational hemisphere. Okay, so now we will take these cerebral cortex. We we studied about these cortex, like they are the four: the frontal, temporal lobe, parietal and occipital. So first we will start with the frontal lobe. Now this frontal lobe, it constitutes almost one third of the entire cerebral cortex. And if we look back, if I try to draw the diagram of this lateral aspect of the cerebral hemisphere, what was that? There was two sulcus. One was the lateral sulcus of the Sylvian, and the other one was the central sulcus of Rolando. So this area of the cerebral cortex, it is known as frontal lobe, and this is central sulcus, right? Central sulcus. So it constitutes one third of the entire cerebral hemisphere. Now this frontal cortex, it can be studied in two parts. One is precentral cortex. precentral cortex, and the second one is prior to the precentral, that is called as prefrontal cortex. So the precentral one means it is in front of the central sulcus. So in front of the central sulcus, what is the name of the gyrus? That is called as central gyrus. So almost entire of this central gyrus. And if we look at few of the minor sulcine gyri in the frontal lobe, they are like horizontally dividing the frontal lobe into superior, middle and inferior. Superior, middle and inferior frontal gyrus. So the posterior aspect of the superior, middle and inferior gyrus and entire of this central gyrus, this much, it will form, this part is called as precentral cortex. And in front of this precentral cortex, the remaining part of this part of frontal lobe, it is known as prefrontal cortex. So one by one, first we will study the precentral cortex. In the precentral cortex, there will be primary motor area, premotor area and supplementary motor area. So the primary motor cortex, that is the first one, the primary motor cortex. What is the area number for the primary motor cortex? Area number 4. This one we have covered in the motor movement, and this represents the entire map of our skeletal system, of our entire body. There is a topographical representation of our entire body in this area number 4, and this lies just in front of the central sulcus. This is the precentral gyrus, right? If we look at, say, this is the superolateral aspect. Just imagine this part is the cerebral hemisphere. This is the superolateral aspect and this is medial aspect. So our body is represented upside down, the motor map of our entire body. What does it mean upside down? Means the lowermost part, this part, it represents our head, and then our mouth, tongue, these muscles of the pharynx and larynx. Then if we move from upward on this superolateral aspect, there will be representation of neck and then upper limb, then trunk. There will be the upper limb representation will be like, there will be the fingers, thumb and finger, then, or we can say forearm, then there will be arm, then there will be trunk representation. And each and every part of the body will have its proportionate topographical representation depending on how fine or skilled movement it is performing. Like the fingers and thumb, they will have very large area of representation as compared to the entire forearm and arm. And then trunk will have very less part of representation on the superolateral, this lateral aspect of the cerebral hemisphere. Now on the medial aspect of this cerebral hemisphere, if you look at this medial aspect, it will have the hip or hip area on the superior aspect of the medial part, and downward, as we go downward, then the lower limb, then there will be the lower limb representation. So we can say on the lateral aspect, the upper part of the body above the hip area, that is represented upside down on the lateral aspect, and the pelvis and lower limb is represented on the medial aspect of the frontal lobe in the this one premotor cortex. Okay, and this premotor cortex, or not the premotor, sorry, the primary motor cortex. The primary motor cortex, this is area number 4. It is concerned with the voluntary movement that we covered in the motor system, voluntary movement, to perform any voluntary movement. So if there is any lesion in this primary motor cortex, then there will be, depending on how severe is the lesion, there are two terms. One is called as paralysis, right? And the other term is called as paresis. there is a subtle difference between these two terms. Paralysis is almost, we can say, almost complete weakness. Not the weakness complete like we cannot use the entire limb. If that we call it that this limb has got paralyzed. Paralyzed means we cannot perform the movement at all. And paresis is a bit less than the paralysis. That is weakness. That person won't be able to perform the movement. He will feel very weak. He is not able to perform. So paresis is just a lighter version of the paralysis. So if there is any issue or lesion, depending on the severity, how severe the lesion involving this primary motor cortex is, there will be paresis or paralysis. Mainly there will be, most of the times it happens in the case of the stroke. Like stroke means the blood supply is compromised in the brain. Okay, so that compromise in the blood supply can be either due to the obstruction at the artery itself. There will be the origin of the obstruction, that is called as formation of thrombus, or the thrombus is formed or the clot is formed somewhere else in the body. It gets disrupted and it will, along with the blood flow, it will come and obstruct the arterial supply of this part. That thing is called as embolus. So either the embolus or the thrombus is obstructing the blood supply. That is the most common cause among the stroke. So there might not be the complete absence of the blood supply, but very much compromised. So that's why most of the times, in most of the situations, there will be the paresis. Okay, depending on which part is involved, that part will have paresis. So that is primary motor cortex. Now coming to the second one. This is part of precentral cortex. Like the frontal lobe, we are studying it by dividing into two parts, precentral and prefrontal. Out of the precentral, one is primary motor cortex. The second one is premotor cortex. Now the premotor cortex, the area number 6. This is the premotor cortex. And this one, then the third one is frontal eye field, right? The frontal eye field. This was area number 8. And it also includes one more, that is motor speech area. Motor speech area or Broca's area. That is area number 44. Area number 44 and 45. So all these 5 areas, they are studied under the precentral cortex. So primary motor cortex we have covered. Now coming to the premotor cortex. Now this premotor cortex, this one is, if we look at the electrical activity of the neurons present in the premotor cortex, we have observed that the activity in the neurons of the premotor cortex precedes, it occurs before the activity of the neurons in the motor cortex, primary motor cortex. It means the primary motor cortex is concerned with performing a voluntary motor movement, and premotor cortex neurons, they are getting activated prior to this one. It means it helps in, major concern is with the planning of the movement. They will plan the movement and this will execute the movement. Okay, so the premotor cortex, so area number 6, it is concerned with the planning of the movement. And if there is any issue or any lesion, like I said, the blood supply, most of the times whatever the stroke occurs, like that is due to the compromise in the blood supply. So if I try to draw the diagram of this like the frontal cortex, this is the central sulcus, then there are the smaller finer arterial supply coming, like anterior cerebral artery will supply on this aspect, and the middle cerebral artery will supply the medialmost aspect. In the next class we will talk about the blood supply in detail. So just for the time being, to understand how these areas are involved, like say if this branch is involved, that embolus comes and obstruct only these two, it means this area will be involved. If it involves this branch, then this area will be involved. So this is the primary motor cortex only this part of the primary motor cortex was involved in this situation. In the second scenario, the premotor is lying in front of the primary motor, this area, and out of the premotor only this much area of the premotor is involved. So depending on how much involvement of the premotor cortex occurs, there will be deficiency or symptomatic representation in that person, and that symptom, that is called as apraxia. Now what is apraxia? Apraxia means it's neither paresis nor paralysis. Apraxia means that person is unable to perform, like unable to pattern and execute, patterning and executing a particular movement. What does it mean? It means that person, suppose like this limb, the left upper arm, it is supposed to pick the pen from the table and write something over here. So this entire movement, there should be a pattern. First I have to move my arm toward the table to pick this pen up, and while picking it up I have to contact my hand muscles, then flex my forearm towards my trunk, then move it away towards the board, and then I have to write down the things. While writing down, there will be the movement of the fingers and these hand muscles. So there is sequence. First I have to move it away toward the table, then I have to move my hand muscles to pick it up, then flex the forearm toward the body, towards my trunk, and then I have to move it away and write down the things. So that sequence should be followed. So that pattern, if this area is involved, then that pattern will be lost, and that person won't be able to execute the movement in a pattern way. So this complex movement can't happen. Though the individual movement can happen, like the person can move the arm up to this much, but then again will not be able to do. He or she won't be able to pick the pen up, then he or she might move the arm toward the body without even picking up the pen. So that pattern and sequencing of the execution of a complex movement will be lost, though the individual movement might be present. So that is called as apraxia. Apraxia happens when the premotor area is involved. Now coming to the third one. This third one is frontal eye field. Now the frontal eye field is, it is present, like say if I draw this diagram, this is the central sulcus, this was primary motor cortex, this is premotor area, and this frontal eye field is lying in front of the premotor itself, that area number 8. Now this frontal eye field, it receives afferent from the occipital lobe. The occipital cortex will send the afferent from the occipital cortex, it will come. And the second, dorsal medial nucleus of thalamus. Dorsal medial nucleus of thalamus will also send afferent to this area number 8. And from this area number 8, efferent will go to cranial nerve nuclei of 3, 4 and 6. These are the cranial nerves which are involved for the ocular movement. They supply extraocular muscles, right? 3, 4 and 6. Oculomotor, trochlear and abducens nerve. So this area is concerned with mainly it is concerned with the horizontal gaze of the contralateral side, right? Everything is regarding the contralateral. If the left side is involved, right side get affected. If the right side is involved, left side will get affected. Similarly, the right sided area number 8, this frontal eye field, it is concerned with the contralateral horizontal gaze movement. Like when my eyes this left, regarding the, like say if I am talking about the left frontal eye field area number 8, it means it is concerned with the horizontal gaze of this, oh sorry, not the left, this is the right area, okay, right. If I am talking about the right frontal eye field area number 8, then it is concerned with the contralateral side movement opposite in that direction of the left eye. Right eye frontal field is concerned with movement of the left eye horizontally. It will move away, right? If there is a lesion, then it won't move away, that part will be lost, but this side is intact, so it will move the eye towards the lesion. Did you get it? Like say the right frontal eye field is concerned with movement toward the contralateral side, opposite side of this left eye. It moves toward the lateral aspect. So if this sided frontal eye field lesion is, there is a lesion, it is like abnormal, it has got disease, it has got less blood supply or reduced blood supply or absent blood supply, then this movement of the eyeball won't happen, but opposite side frontal eye field is intact, so this eye will move this way, so the conjugate movement will happen, so eyes will get deviated toward the site of the lesion. Did you get it? So, and this one is very small area, so instead of involving this part, say as I said, the most of the times it is the lesion in the blood supply. So the blood supply of not only this much, this area is concerned, involving the premotor and the motor. If it involves posteriorly to the motor area, then the nearby area is for the facial, contralateral facial. And we know, like in the previous class, I uploaded the video regarding the upper motor neuron lesion of the facial nerve, because the upper part of the face is represented bilaterally. So if this frontal eye field lesion extends posteriorly, then it will involve the contralateral face, but the upper part of the contralateral face is also receiving the nerve supply from the same side, so it will get spared, but the lower part of the face will involve. If the lower part of the face is involved along with the frontal eye field, then there will be deviation of the mouth. This angle of the mouth will deviate opposite to the affected side, because this part is involved, and eyeball will move toward the lesion. That will the characteristic appearance of a particular person who has got lesser blood supply to this particular area extended up to the motor cortex. Okay. Now coming to the fourth one. This is the motor speech area. Now the motor speech area number 44 and 45. If I draw the diagram of this frontal lobe, say, and suppose this is the central sulcus, and then there was this thing, say, lateral feature, right? So this much, this area is area number 44 or 45, the lowermost part, area number 44 and 45, and it is involved with articulation, to express like I am expressing myself by speaking and by writing down. Okay, so both the things, either I am speaking it up or writing it down, I am expressing my thoughts. So these areas are concerned. Okay, area number 44 and 45, Broca's area is 44. Okay, so this, along with the 44, the nearby area 45 is also involved in this expression, either the verbal or in a writing way. Okay, so if there is any lesion, like the blood supply is compromised, then that affected person won't be able to express himself. That's why that lesion will be called as expressive aphasia. Expressive aphasia. Aphasia means there is inability to perform that thing. Expressive. That person is not able to express himself either in the way of speaking, verbalizing, or writing his thought. And this one is also called as motor aphasia. Either we call it expressive aphasia or motor aphasia. Motor means because the motor activity, either verbalizing or writing the thing, the motor movement is required. So that's why it is called as motor aphasia or expressive aphasia or Broca's aphasia, because the Broca's area is involved. Broca's aphasia or non-fluent aphasia. Fluency, if I am speaking fluently or writing down, that's called as fluency. So that fluency will be lost. It means, like say, just take the example. If I ask you a person, like a student, the entire day activity of a student, like he wakes up in the morning, then goes to the college, attends the classes, then goes to the market, all these things, and at the end of the day, if I ask that student who is suffering from this Broca's area, like what did he do today? That person, that student knows what I am asking. He understands the question, he knows the answer, but he is not able to express himself either by verbalizing or by writing down. He won't be able to write down even the answer because cannot express. So that makes him frustrated. And if I keep on poking, asking multiple times, what did you do today? What did you do today? What did you do today? He won't be able to say anything. At the max, he might say, went to college. So not expressing him entirely. If you keep on pressing, then might end up with went college. That's not fluent. That's the non-fluent. So that all these four terms, they are one and same thing. Either the expressive aphasia or the motor aphasia or the Broca's aphasia or the non-fluent aphasia. And if similarly, like we talked about the frontal eye field, if this area blood supply is compromised, so this is a very small area. So the almost the adjoining area of the motor cortex, if it also gets involved, the blood supply, then that person will be having paresis of the contralateral. Paresis of the, this part is lower part. So because this is the lower part and this represents our upper part of the body in the topographical representation, motor homunculus. So if only this much is involved, then there might be issue with the upper part of the body or head of the body, or we can say the facial part. In the facial part is involved, only the facial part is involved, then the same thing. The contralateral side, lower part of the face, there will be the deviation of the mouth and that person won't be able to express himself. If the entire of the cortex is involved, then entire of the contralateral body, paresis will be there and that person won't be able to express himself. But most of the times, only this area 44 and 45 is involved, not the adjoining area. So in the Broca's area, everything will be normal in that person, but he will not be able to express himself. That's why that is called as aphasia. It is not called as dysarthria. There are a few terms you should know. Dysarthria means, it also means the patient is not able to speak the thing. Okay, but in dysarthria means he or she is not able to perform the motor activity of speaking the thing, like the motor involvement, like the tongue movement, starting from my mouth up to the vocal cord. All those muscles are involved in verbalizing or vocalizing the thing. If that part is compromised, then it is called as dysarthria. But in this one, all the motor faculty is normal. Only the area number 44 and 45, it is this concerned area is not working properly. So that's why this is expressive aphasia. Okay, so that's regarding the precentral cortex. Now